All too often, patients come home from the hospital or doctor's office with a folder of self-care instructions either they don't understand or don't know how to use. As a result, patients often return to the ER, leading to hospital penalties, or worse, dramatically lowered satisfaction scores. Instead, a care kit has everything a patient needs for self-care in one place, including curriculum, tools, and devices. Each care kit is designed based on the proven science of adult learning principles combined with the clinical standards of care for each condition. This makes them engaging, in plain language patients or health plan members will understand. 1. Self-care tasks are conveyed using goals and steps, using the patient's own language to explain and communicate key tasks. 2. Practical household reference tools such as posters, magnet boards, and logbooks are included to remind and encourage patients to perform their tasks. Vetted devices such as scales and blood pressure monitors tailored to each condition promote compliance. Care kits are used by many of the nation's top providers and health plans and have been proven to reduce readmissions and ER visits over 74%. For more information, contact us on our website at www.carekit.com.